Hi, I'm Dr. Michael Schwartz, and we're going to take you through a video of a young woman here having her upper eyelids done. We've broken these down into 10-minute segments for convenience of viewing, and this is really the upper eyelid portion, although she's had her upper eyelids, lower eyelids, a mid-face cheek suspension, and a mid-face lift done, and we're going to be showing you those separately. In a sitting position, I carefully measure the line or the distance from the eyelashes where I want the final scar to lie, and I want that to be perfectly symmetrical on both sides. Most people are not born perfectly symmetrical as the face forms in vertical halves. Most often the orbits where the eye sits are different sizes. The eyelids can be different shapes and sizes, and there can be varying amounts of excess skin, also related to how much the brows are drooping on either side, or the actual position of the brows. What I do is make sure the lower limb that we're now cutting is at the same distance from the lashes, and then the skin to be excised, and subsequently the upper line that you see is a little bit variable, but I also am really cautious about making sure that somebody can easily close their eyes. So she has her eyes closed in sitting position where I'm marking before the surgery the amount of skin that's going to be taken out. Here we're making the incisions. I don't think it's readily obvious, but I bevel the incisions out. The lower limb goes out this way, the upper limb goes this way, and then, as we'll see at the end, I want those edges to be perfectly apposed and everted, because with healing comes contraction of the scar, and if they're not everted, they're likely to indent. So I want this scar to be perfectly flat and heal so that it maximally disappears. And we've planned it so that it goes into a natural skin tension line. As you'll see during the closure in a woman, I like to arc the incision up and outward at the lateral aspect of the eye to simulate how makeup's put on. It also enables me to trim skin here and get some better tightening of the outer area of the eye and avoid a droopy or hooded look out here. I think that's a really great technique when planning the skin excision in a woman's upper lid. In men, it's really important to not do that. I see a lot of men with feminized upper lids, and I'll talk more about that in a minute. Here I'm removing a small additional strip of muscle that was left behind. I'm now going to cauterize the wound bed even further with a needle tip cautery. This is an electrocautery needle tip, very precise. We can cauterize on low power vessels that are really close to the skin edge. We don't want to cauterize the skin edge at all, because obviously we don't want to burn the skin. I'm now going to have my assistant retract the skin at the medial aspect of the lid. I've taken some scissors and just bluntly spread in there while gently pressing on the eye to cause the fat in that medial compartment to pooch out a bit, if you will, and then we'll clamp it, trim it, and cauterize it with the Bipolar cautery. I can demonstrate that fat if I close my eyes and press on my eyeball. You might see a little puffiness, or a lot of puffiness in my case, in the medial aspect of my lid, and that's what we're trimming here in this patient. We don't want to overdo that. You don't want to have a hollow eye appearance, and I carefully evaluate everyone before surgery to make sure that they need that. If someone has deeper set eyes and they don't have a lot of fat there, depending on each person's anatomy, I might not remove any fat. I might remove a significant amount or just very little. This is a moderate amount in this patient. I'm now cauterizing the fat in the compartment. We don't want any blood vessels to break loose and bleed later on. This could create problems postoperatively. Here I'm just going through the wound bed again and making sure that every little spot is dry. I think that gives a much better chance of minimizing the post-operative swelling and bruising. I've now placed a skin hook at the outer edge of this, the incisions, and now I'm going to close from medial, or the middle part towards the nose, to lateral. We use a very fine monofilament suture. People use different types of suture. Some people use absorbable suture here. I think there's a bigger risk of creating suture marks, as absorbable suture is more reactive in the skin. This is a very fine monofilament, and we leave it in 5 to 7 days and remove it. Again, I want these edges to be perfectly matching and slightly averted, which they will be because of how I pass the needle and hold the skin edge up with each pass of the needle, and also because of the beveling I've done while making the incisions. I think that lower edge there was a little bit beneath the upper edge, and I really want this to be perfect, so it's no problem to back the needle out and replace a stitch. If it's going to make the closure more perfect, I'll do that every time. It's not a problem. Again, just to point out the differences in planning these excisions of skin in men and women. This again is arcing upward and outward at the outer part of this woman's eye. It helps tighten the outer part. It mimics the way makeup is applied. It's an elegant look, but in a man it's kind of an unusual look. It would make a man look overdone. So I think it's important to plan the incisions differently. It would end a little earlier in men and not have that upsweep, and in that way a man can look rested and younger but not done or not operated. And I think that's important with all the cosmetic surgery I do. I want people to have the result that they are looking for without looking operated. I think that's really important. If someone looks like they've had surgery, it's kind of a failure to me. Here in the left upper lid is difficult to see, but we're doing the same exact thing, removing now the skin and orbicularis muscle. And now we can see from the top view, I'm using the bipolar cautery again, just ensuring that the bed is dry. Every tiny little bleeder is cauterized. The fat compartment has been exposed and teased out, and now we're going to clamp it and trim it, and then again cauterize it, make sure there's no bleeding. And then the closure is just the same as in the right lid. Thank you for watching this video, and we're happy to answer questions. If you'd like to give us a call or email me, I'm happy to respond personally to email, which I do every day. We're going to post some additional videos, and this very kind and cooperative patient who agreed to share her surgery with you. We're going to show her lower lids and cheek surgery, mid-facelift surgery, and we'll follow up with more information about that. Thank you.